We need to think of the implant as a system. It's a very beautiful but complex biomechanical system, the implant. It is comprises of soft tissues, hard tissues, mechanical elements. That's what I explained in my lecture. Hello, I'm Dr. Minas Leventis. I'm an oral surgeon from Athens, Greece. I have a dental degree, a Master of Sciences, and a PhD in oral surgery. The last 10 years I live in London, the UK, and half of my job is to do research, publications, and lecturing, mainly on the topics of bone grafting and implantology.
What do you think about the Dental World Conference? Do you enjoy the event and its atmosphere?
It's my second time. It's always a pleasure to be here. It's very big. I see it's crowded, many people, many clinicians, and also during my lecture I had lots of attendance. So it's really good, nicely organized, and very professional.
How do you balance biological principles with simplified clinical protocols to maintain both predictability and efficiency in daily implant practice?
It's a very complex subject. So in our protocols, in our everyday practice, we need to combine science with clinical practice, and we need to translate what we find out through our experimental research to make it work in our everyday clinical practice. So we develop new materials based on biological concepts that can help us to design less invasive and simpler techniques.
In your experience, which innovations in biomaterials have most significantly improved bone and soft tissue healing?
In my field, and everything is backed up from my research the last 20 years, now we have focused and we develop two different kinds of new biomaterials. The one big area is we develop materials that they control the bacteria, they control the biofilms, and at the same time they accelerate the soft tissue healing. So these are new materials. They release oxygen and lactoferrin. These are two very important elements to target the harmful bacteria, because whatever we do in dentistry and in surgery in the mouth has to do with bacteria, and we need to control them. And at the same time, they speed up the healing of the soft and the hard tissues. And the other big area that we work on is bone regeneration. The last years, we research and we develop new synthetic bone grafting materials that they help us to regenerate new bone.
Can you share how structured workflows based on biological systems contribute to long-term implant success and reduced complications?
Exactly. What we need to do, we cannot work by luck. So in order every clinician to become good in his field, he needs to know exactly all the elements of the work he is doing. So let's say for the implants, they are a biological system. So in my lecture, I explained which are the fundamental elements of this system of implants. I analyzed each of these elements. So what we need simple protocols. We need clear strategies, clear protocols that make sense, that we can understand. And when we understand what we are doing and we plan with the protocols our cases, then we have predictability and we have consistency. So the clearer and the more logical the protocols we have, and we work on them and we use them every day, the more predictable and consistent our results. This is the key.
What is the take-home message of your lecture?
My take-home message of my lecture is that we need to think of the implant as a system. It's a very beautiful but complex biomechanical system, the implant. It is comprises of soft tissues, hard tissues, mechanical elements. That's what I explained in my lecture. So for everyday successful results, we need to think and take care of all the elements of the implant system. It was my second time. The event is excellent, big, many booths, many companies, many distributors, lots of clinicians. Everyone is very interested. I hope that I will be here next year in 2026. And I invite all clinicians that haven't been here to join the expo because it's really useful. Thank you.